Good, e- good evening and welcome back. This is FM show KE. So today is a hit or miss for Mutahi Kahiga. We all know Mutahi Kahiga is our Wamunyoro descendant or a trustee of former Deputy President Rigathi Gachagua. But today he has gone hard on President William Ruto over elections or over the ministers that President reinstated after firing or the reshuffling that President William Ruto has been carrying lately after the Gen Z protest in July 2024. So, Nyeri Governor Mutahi Kahiga urged President William Ruto to minimize cabinet changes, citing disruption to key project. He was speaking when governors led by their chair Ahmed Abdullahi met health CS and Duale to deliberate on the state of the health sector. Duale pledged to fast-track digitalization of health facilities and streamline UHC staff absorption and community health promoter payment. So, Nyeri Governor Mutahi Kahiga has called on President William Ruto to exercise restraint in the frequency of cabinet reshuffles. Kahiga warned that constant changes within key ministries could hinder the implementation of the critical national programs such as the universal health coverage. Speaking during a high-level conservative meeting attended by Council of Governors COG's Chair Ahmed Abdullahi, Cabinet Secretary Handen Bare Duale and other key stakeholders in the health sector, Kahiga emphasized the need of continuity in leadership, particularly at this delicate stage of UHC rollout. We have made some very positive progress, Kahiga noted. My plea to President William Ruto is that there is simply too much movement. We are at a very critical phase in the implementation of the health universal health care coverage. It's important to allow those entrusted with responsibility to settle into their roles, understand the project and hand and push these programs forward. Kahiga warned that excessive reshuffling within the cabinet could become counterproductive, arguing that it not only destabilizes coordination between national and county government but also stalls progress in delivering essential services to citizens. Give Duale some time to acclimatize and be able to push this program for the sake of Kenyans and for the sake of the county governments. Who knows this too much? Change can become detrimental here. And during the forum, Duale provided an update of on ongoing effort by the government to reform and strengthen the healthcare sector. He noted that the discussion largely revolved around the rollout of the newly established Social Health Authority (SHA), the digitization of health services across the counties, and the smooth absorption of healthcare workers supporting the UHC agenda. We agreed to expertise the digitization of health facilities in all 47 counties. This initiative will be led by the digital health agencies and is aimed at significantly improving service delivery, reducing inefficiency, and ensuring better patient outcome, Duale stated. Duale also revealed that there is a shared consensus on the need to channel more financial resources towards managing emergency, chronic, and critical illnesses. Additionally, he emphasized the importance of equipping health facilities in charge with proper training to enhance their capacity in managing registration processes and service delivery under the new SHA framework. A joint plan was adopted to address the long-standing concern around the employment and remuneration of UHC support staff and community health promoters. According to Duale, county government will soon conduct a health count of UHC systems staff, which will inform a structure and payroll system. The national government in turn will release the necessary funds based on the salary scales approved by the Salaries and Remuneration Commission. Duale also noted that the ministry is committed to creating a robust account health system by working closely with the county government officials. Our goal is to establish transparent, integrity driven partnership with counties with the ultimate aim of strengthening the healthcare system for the benefit of all Kenyans, he said. He also highlighted the indispensable role that healthcare workers will play in the success of Taifa Care. the flagship program under UHC, stressing the need to invest in human resources to guarantee the sustainability of the reform. Duale also want to root out fraud and corruption in medical facilities, seeking to get money like illegally government. So Mutahi Kahiga has gone ahead to defend Adenbare Duale. He is simply telling President William Ruto, bwana, usitoe huyu jamaa kwa CS bwana, usimtoe hapa kwa health. Let the guy maintain the health docket. We all know that a health docket is one of the biggest cabinet dockets in the country. So tunaweza sema Mutahi Kahiga anaamini Duale, or kuna pesa imetembea mahali hapa katikati. That's why Mutahi is very keen on Duale maintaining the health sector, or the governors are benefiting from the SHA rollout or the SHA movement, because we all know that Duale he will defend SHA with by blood by fire. Huu ni jamaa atachunga hii SHA kwa upanga, but you will defend it with the barrel of the gun. What do you think, guys? Leave a comment on the comment section, share, like our videos, and don't forget to hit the subscription button. This is FM Show KE.